Did you know that periodontists specialize in the placement of dental implants? Well, we actually have a board-certified periodontist, Dr. Richard Aguila of Jacksonville Dental Specialists, here to talk to us about the specialty and what being hybrid certified actually means for people that are looking for dental implant solutions. Hello.
Hey, how are you?
Back again. Glad to have you.
Thanks for having me.
Okay, so tell us a little bit more about what your specialty is and how it can help people that have complex dental problems.
Sure. Periodontal means around the tooth. So my specialty is the diagnosis of treatment of diseases that affect the supporting structure of the tooth, the gums and the bone. We also have training on the surgical placement of dental implants and IV sedation as well. So that's what my specialty is. It's one of the 9 recognized specialties of the ADA. My partner is a prosthodontist, and he's a restorative specialist. So he does crowns, bridges, you know, full arch restoration. So together at our office, we treat the most complex cases. And when you're treating these complex cases, it's very important to see specialists. Patients get the most up-to-date treatment with the most up-to-date technology from doctors who have the most experience and training with that.
Right, and you just touched on that experience. That's a big deal, especially when you're getting into someone's mouth and dealing with their smile. Can you tell us a little bit about why it's so important to be certified in hybrid and what you guys have to offer in that department as far as experience goes?
Sure. A hybrid certified provider is someone who's been trained and passed a certification process. And it consists of oral surgeons, periodontists, prosthodontists, and highly trained general dentists. And we have a network of providers that provide this process called hybrid. And the process of hybrid allows us to give full arch restorations in a highly predictable manner. We use treatment protocols that are proven, that have evolved with technology, that provide patients with care in a very predictable, simplistic fashion, minimal surgery, minimal discomfort, and it's really changed the lives of many patients.
I imagine, and again, like it's always a little nerve-wracking when you have someone going into such a sensitive part of your body. What do you guys do as far as offering peace of mind when it comes to the safety of the entire operation?
Sure. Oftentimes these patients, especially with our complex surgeries and complex treatments, they're oftentimes sedated. Mm-hmm. So they're sedated throughout the procedure, they don't remember anything. We also use the most up-to-date technology. With technology today, the cone beam CT scans, the digital scanners, it allows us to basically do virtual surgery before we actually do the treatment. So we know exactly what the bone looks like, we know what the anatomy looks like, we know exactly, you know, where and how to place the implant in a certain angle and things of that nature. And the technology just makes it so much more predictable for our patients, and again, allows us to do things minimally invasively.
Definitely. So what about someone or a case in which someone has gum disease? Is that affected in getting that restoration?
Yes, that's a great question. And me being a periodontist, I get it all the time.
Oh, great.
Yeah, so periodontal disease, it's a chronic infection of the gums and the bone, and it affects roughly more around 50% of the population. You can have mild forms to severe forms. So it's very common. It's a chronic infection of the supporting structures of the tooth, the gums and the bone. The thing with the hybrid, by removing the teeth, you get rid of periodontal disease, okay? Not saying that you can't have bone loss or inflammation around implants, but it's less likely to do that, okay? For patients that have had periodontal disease, by removing the teeth, you kind of change the environment. You change the bacterial environment of one of disease to one of health. Okay. Once health is established, it's important for that patient to maintain and clean to allow, you know, the bone to be preserved, the gums to be healthy around the implants, which will bring longevity to their treatment.
Yeah, that makes a lot of sense. So can you tell us really quickly then where people can learn more, how they can learn more, because hybrid is obviously, there's a lot to it. So can you tell us a little bit about that?
Sure, we have a website, and we also have monthly seminars. Our next one is actually this coming Wednesday on the 14th.
Okay.
It's in our Jacksonville office. You get to meet the doctors, you get to meet the staff, tour the facility, get all your questions answered, and then by attending you get to have a complimentary consultation for your treatment.
Well, there you go. You guys don't want to miss that. So we'd like to thank Jacksonville Dental Specialists for sponsoring this segment, and you, doctor, for being here. For more information, you can visit jacksonvillehighbridge.com or give them a call at 904-584-3867.